While speaking about the biochemical mechanisms of the cell injury, the first one is ATP depletion. Next one is intracellular accumulation of calcium. Third one is accumulation of oxygen-derived free radicals, which is oxidative stress. Next we can go for the mitochondrial damage and the membrane damage with the permeability loss. First one is the ATP depletion. ATP depletion, this is because of the hypoxia. This causes the decreased ATP synthesis. This depletion results in failure of the active transport by the cell membrane and the accumulation of the sodium and water into the cell. Defects in the protein synthesis, lipogenesis and the phospholipids turnover, leading to the loss of integrity of the plasma membrane. Second one is the intracellular accumulation of the calcium, which is called the ischemia, that is the deficient blood supply increases the concentration of the cytosolic calcium, leading to the activation of the catabolic enzymes, which is the phospholipids, protease, ATPase and the endonucleases. This results in the cell membrane damage, the breakdown of the proteins, ATP depletion and the chromatin damage. Third one, this is the accumulation of oxygen-derived free radicals called the oxidative stress. During the generation of the energy by cells, small amount of the reactive oxygen forms and the free radicals are produced. These forms or can damage the lipids, proteins and the nucleic acid. They are referred to as reactive oxygen species. Cells have the defense system to prevent the injury. These are caused by this product. An imbalance between the free radical generating and the radical scavenging system results in the oxidative stress, leading to the cell injury. Important pathologic sources of the free radicals include prolonged ischemia, which is called the venous obstruction. Second is bacterial infection and the radiation. Oxygen and the oxygen-derived free radical affect the cells as follows. One is lipid peroxidation of the cell membrane, leading to the cell damage. Oxidative proteins, this leads to the damage of the proteins and enzymes. Next is DNA damage, this leading to the death or cancer. Free radicals induced cell injury. Free radicals, they are highly reactive and stable species that interact with the proteins, lipids and the carbohydrate. These are involved in the cell injury, which is induced by absorption of the radiation energy, oxidative metabolic reactions, enzymatic conversion of oxygenous chemicals and drugs. O-derived radicals, these are the toxic species and the superoxide. While speaking about the mitochondrial damage, the mitochondria can be damaged by the increased cytosolic calcium, oxidative stress and the breakdown of phospholipids. Fifth one is the membrane damage with the loss of permeability. This can lead to the ATP depletion, loss of phospholipid due to the activation of the phospholipases by increased calcium. Toxicity of the oxygen-derived free radicals. Various infections, chemicals or the physical factors can also cause the various reactions. This are caused by the chemical or the physical factors. While speaking about the reversible injury, we can say the cells of the tissue return to the normal structure and function after the removal of the injurious factor. Morphology, for example, hydrophic change. This is the accumulation of the water and sodium into the cell. While speaking about the fatty change, this is the accumulation of fat into the cell. Next one is hydrophic change. Hypoxia results in the ATP reduction, which affects the membrane like sodium potassium pump, leads to the accumulation of water and sodium into the cell and the cellular swelling. This affects the all type of cell and considered the first sign of the cell injury. Fatty change. Hypoxia leads to the release of the fat from the cell membrane, which appear as a small or the large lipid vacuoles in the cytoplasm. Irreversible cell injury. Cells and the tissues affected do not return to the normal structure and the function. Morphology. Severe cytoplasmic vacuolation, mitochondrial damage, severe damage of the cell components and membrane. While speaking about the necrosis, this is a form of morphologic changes that follow the cell death in the living tissue. The morphologic appearance of the necrosis is the result of the denaturation of the intracellular proteins and the enzymatic digestion of the cell. These enzymes are derived either from the lysosomes of the dead cells themselves or from the lysosome leukocytes during the inflammatory reaction. If it is from the lysosomes of the dead cell themselves, this is called autolysis. If it is from inflammatory reactions by leukocytes or some other cells, this is called heterolysis. Common types of the necrosis. One is the coagulative necrosis. These are common in the heart, kidney and the spleen. The affected tissue is swollen, firm and yellow with the visible outlines of cells. Liquefaction necrosis. This is from the rapid action of the hydrolytic enzyme common in the brain with the bacterial infection. The affected tissue is soft liquid like with a complete loss of the architecture. While speaking about the coagulative necrosis, this is a myocardial infarct. The third type is the caseous necrosis, chronic type of coagulative necrosis with a fragile CC appearance. It is characterized for the TB. Gangrenous necrosis, it is a combination between the coagulative and the liquefactive necrosis common in the legs. While speaking about the fat necrosis, this is due to the action of the activated lipases common in the fat of breast, that is traumatic, and the peritoneum, which is alcoholic. The liquefactive necrosis in brain. Gangrenous necrosis in tissues like which are present in fat necrosis in the pancreas. Fat necrosis, this is a proper image of the fat necrosis which is present in the pancreas. Here we can look for the morphological cellular adaptations: atrophy, hyperplasia, hypertrophy and metaplasia. Atrophy, decreased cell size and the functions due to the reduced number of the cell organelle. For example, brain atrophy due to the aging, pressure atrophy due to the mass lesions, nutritional atrophy due to the starvation, and atrophy due to the febrile disease. Testicular atrophy. Hyperplasia. This is a decreased cell number due to the failure of the proliferation during the development. For example, dwarfism. This is the hyperplastic tissues due to the reduced level of growth hormones or the lack of its receptor. Hyperplasia, increased total mass of an organ due to the increased number of cells by the frequent cell division. Enlargement of the breast during the pregnancy due to the hormonal effects. Endometrial hyperplasia, this is the pathological one, and the bone marrow hyperplasia, this is the compensatory one. This is the endometrial hyperplasia as shown in the figure. Hyperplasia of the prostate. Hypertrophy, this is the increased total mass due to the increased size of cells without the cell division. Increased functional demand on the hormonal stimuli result in the enlargement of the uterine fibers during the pregnancy. And we can also see the compensatory hypertrophy in the renal donors. Hyperplasia and the hypertrophy are frequently occur together. For example, hormone-induced growth in the uterus during the pregnancy involve both increased number and the size of the smooth cell and the epithelial cell. Metaplasia. Transformation of one type of the differentiated tissue into the another. For example, the cigarette smoking makes the bronchial epith becomes a squamous instead of the columnar. For example, the metaplasia of the normal columnar to the squamous epithelium in the bronchus. This is shown in the figure, which is the schematic and the histologic one. Here we can see the normal columnar epithelium, which is converted to the squamous epithelium. Thank you.